Being a veterinarian can be satisfying and rewarding, caring for beloved pets that can't care for themselves or even speak up when they're sick. But it can also bring mental health challenges that some feel have not been adequately addressed. Now, some veterinary schools are trying to do something about it for the next generation of vets. We should warn you that this story discusses suicide.
Yeah.
For as long as she can remember, Chelsea Van Thoff wanted to be a veterinarian.
Exactly. I loved animals. I was little and I wanted to be an animal. There's just connections that you can feel with animals that sometimes you can just never get with a person.
Like now.
Like now, yeah.
Her 4-year-old Dalmatian, Hugo, has sustained Van Thoff for the past 2.5 years, ever since her partner and vet school classmate Peter Tripp took his own life.
Hugo kept me going. I don't know if I would be here if I hadn't had Hugo when Peter left.
Van Thoff and Tripp met in a vet school study group.
I remember walking into the room and being taken with him immediately.
She recalls how he always thought of others, donating blood and even bone marrow, and helping her when she felt consumed by the self-doubt of imposter syndrome, that nagging sense that success and achievements aren't deserved. After graduating, they eventually settled in Washington, D.C., where Tripp worked at a veterinary hospital.
I always felt calm with Peter. Everything looked like it rolled off of his back. It's kind of hard to think about now, knowing what was going on in his head.
She says it wasn't until April 2022 that he even hinted at his own struggles.
I had actually asked him if he could see a therapist. And he was very open to it, very open to seeing a therapist.
But at about 9:30 that night, Van Thoff woke to the sound of the front door. She assumed Tripp was taking out the trash and waited to hear him come back in, a sound that never came.
I got a text from him at 10:40, and he talked about imposter syndrome, which was a huge shock to me because he had never said anything. And so, I realize what's happening, and I jump up. I'm just panicking, and I immediately think, this isn't real. Like, this is a cry for help.
A frantic search ended when Tripp's body was found in Rock Creek Park at the base of a 136-foot-high bridge. A 2019 Centers for Disease Control and Prevention study found that veterinarians are twice as likely than the general population to die by suicide. While 3/4 of vets say it's a satisfying career, there are also distinct sources of stress.
Veterinarians oftentimes tend to be so empathetic and caring towards other people. They'll do anything to help others. That's in some ways part of their professional identity, but they have a very different set of rules sometimes for how they respond to themselves.
Psychologist Carrie Carafa is mental health and wellness coordinator at the University of Missouri Vet School. He says part of it is a drive for perfection.
We know that some aspects of perfectionism, like attention to detail or, high kind of personal standards, those can be positive. Those can be incredibly motivating. But if perfectionism is maladaptive, where it's characterized by excessive self-criticism or just deep fear of making mistakes or disappointing others, it starts to become detrimental, not only to academic performance, but also to mental health or well-being in general.
How much of that is because their patients can't tell them what's going on? They can't say, I feel pain here.
Yeah, quite a bit. I mean, they're essentially having to, oftentimes read body language. The quality of the information is sort of dependent on, the pet owner or the client and their ability to self-report. It's not the same as, a human physician who's able to do a clinical interview with a patient who can speak back.
Another study says a big reason for the disproportionate rate of veterinarian suicides is easy access to euthanasia drugs. The difference between suicide rates among veterinarians and the general population goes away when cases in which vets use those drugs are excluded.
We know that in professions where folks have easier access to lethal means, there also tends to be higher rates of suicide. You have to have these things readily available enough to where the veterinarian is able to use it for medical purposes while also being mindful about accessibility for other purposes.
That study suggests that suicides could be prevented with stricter controls on those drugs, like requiring a key card to get them. While those practices haven't been widely adopted, vet schools are increasingly focusing on the underlying issue of psychological well-being. Millions of Americans rely on veterinarians to care for the physical health of their beloved pets, like Basil and Kit here. But at a growing number of veterinary schools, they're launching programs to care for their students' mental health.
And around Christmas time, as an intern, I was on that shift, and I euthanized 12 patients in a 6-hour period. When that last one came in, when that 13th came in, I looked at my supervisor and I said, there is no way in hell I can do this right now.
At Ohio State University's vet school, candid classroom conversations about mental health are part of the primary curriculum.
We talk a lot about resiliency and wellness within the veterinary profession, and part of that starts here.
In this class of first-year students, Assistant Professor Janice Lapsley offers strategies for becoming confident and successful veterinarians, including taking care of themselves.
Starting out now with talking about these topics and opening this conversation for them now is a good way to just build these skills for them, just like we're building the skills for them of how to talk to a client or how to perform a surgery.
None of us are perfect. We've all had our struggles, and I think sharing our struggles, even in the classroom, helps them.
Rustin Moore is dean of the school and a former practicing veterinarian.
About the 21st day of my deanship in September of 2015, we lost a student, a second-year student, to suicide. It came as a complete shock to everybody, but losing that student really changed me, changed the college.
We hope that you will focus as much attention on your physical and mental well-being as you do your academic performance.
The school launched a comprehensive wellness initiative called Be Well. They hired therapists, counselors, and a psychiatrist for students, faculty, and staff. Open discussions about mental health and inclusion were encouraged.
And remember, you actually matter and you deserve to be here.
At last year's new student orientation, the initiative's catchphrase was heard time and time again.
You belong.
You belong. What do you mean by that?
Thinking back to imposter syndrome. I'm not good enough to be here. I shouldn't have been here. I'm taking up somebody else's seat that deserves it more. And my point is, no, we took you because you belong here. You deserve to be here. Don't ever question that.
Sometimes those type of topics and mental health can kind of be like a side note or kind of put on the back burner.
Spencer Varney is a first-year student.
But here at OSU, I really feel like they prioritize mental health and really make sure that the students are well attended to and well aware of themselves.
In Washington, Van Thoff says a program like that would have been helpful when she was a student.
If we were taught as intensively around our own well-being as we are around the well-being of animals, I think it would make a huge difference.
Now she's made a difference by persuading the city to double the height of the barriers on the bridge where Tripp took his own life. 12 other people died by suicide there between the beginning of 2010 and the middle of 2022. For Van Thoff, it's a way of dealing with her grief.
As much as I never want people to feel the kind of pain that I and Peter's loved ones have now, and as much as I want to help people in crisis, it was also a way of taking control of something that was so unimaginable.
You belong here.
At Ohio State, the hope of preventing more tragedies also drives the commitment to the Be Well initiative, even if its effect is hard to measure.
Is there any way to tell if Be Well is making a difference?
Sometimes when you're doing things preventatively, you don't know. And so I don't know, but I'm not going to take the chance to not do it because it's too important.